My name is Melissa. I'm 47 years old, and I had bilateral knee replacement surgery 4 weeks ago. And I used the X10 the day that I returned home from the hospital. And now 4 weeks later, I'm able to walk without the aid of a cane or any other device, and I'm looking forward to having my new knees. So I started having knee problems at 35, and I had been doing a class at the gym on a treadmill, and the next day my knees just blew up and I figured I tore something. So I saw an orthopedist and was told that my knees were twice my age and that I was way too young right now, but someday I'd need a knee replacement, and I was advised take ibuprofen and just deal with it. So over the years I saw an orthopedist, a rheumatologist I even did. I had injections and shots and all of that to try to manage the pain. And particularly at that age, I was quite active, and I wasn't able to run anymore. I had pain just standing up from a chair because they'd be so stiff. I would have pain during the night. And I think with arthritis, it ebbs and flows a bit. I had a period of years where I felt like I was managing it quite well. And I wasn't seeing any doctors or having any injections at that point. And I would have copious amounts of ibuprofen, but I was mobile. I was able to do most of the things I wanted to do, but certainly not everything that somebody my age could do. Then about a year ago, they started getting fussier, and I was experiencing significantly more pain. And I sought out another orthopedist. And I was fully expecting just to get some shots and to be told again that I was not a candidate for total knee replacement. And I went in, and so by this time I was 46, and Dr. Winokur came in, and I said, look, I know I can't have a knee replacement, but is there something? And he had taken my x-rays, and he says, oh no, you are a candidate. He says, if you want a knee replacement, you just let me know, but it's completely your decision, and you'll know when the time is right. So that was kind of a revelation to me. Nonetheless, I did go through a series of cortisone shots, which helped for a time. It's a short time. And after having conversations with him about what was involved with knee replacement, I decided, and he had said to me, it's a quality of life issue. And the implants are getting better and better every year. And I said, you know what? I'm done. I'm done being this constrained at this age. I want to be able to be more active and just walk my dog pain-free. So I thought, okay, I'm definitely going to do it. So then the question was, do I do one or both knees? And Dr. Winokur felt very strongly, given my age and fitness prior to surgery, that I was an absolute candidate for bilateral. And to me, that sounded like a more pragmatic approach anyway. It's one and done. So I went for it, and I'm glad I did it that way. One of my big surprises is that, at least in my experience, it wasn't this horrible, painful, awful thing that so many people warned me about. Actually, prior to surgery, I was a little nervous because so many people said I was crazy. But in the hospital I went to, St. Joseph's Medical Center, was great. My pain was managed well in the hospital, and by the time I got home, I was very able to keep track of it. And like I said, I got on the X10 immediately, and I think just having something that I could do for myself to move toward healing was great psychologically, and the fact that the machine just promotes the swelling to reduce and the movement, I think just put that together, and it ended up being a pretty painless process.